So sleep and our overall health, as I've mentioned so far, sleep can affect every aspect of our life and aspect of our health. So people who are chronically sleep deprived are more likely to be overweight, have cardiovascular disease or strokes, infections, certain types of cancer, have worse memory, concentration, and problem-solving abilities, tend to have higher rates of depression, may be less productive, and make more mistakes at work and school, and are at higher risk of causing fatal accidents than those who get enough sleep. And when we're talking about chronic sleep deprivation, even just losing 1 to 2 hours of sleep can affect performance similarly to losing 1 to 2 days of sleep. So it doesn't take a lot to really be chronically sleep deprived. On the flip side, let's talk a little bit about the benefits of getting good sleep. So when we get good sleep, we tend to lower our risk of serious health problems such as diabetes and heart disease. We get sick less often. We may be able to stay at a healthy weight. It can reduce stress, improve our mood, help us get along better with people. We tend to make better decisions and think more clearly. So it improves cognitive performance. And again, it helps us to avoid injuries and accidents. So how much sleep do we actually need? Adults of all ages, 18 and over, tend to need about the same amount of sleep throughout adult life, and that's about 7 to 8 hours. So that's really what we're aiming for. I find that most people don't really feel that they get that amount of sleep, but this is what we're aiming for, is 7 to 8 hours. It does depend on the person, and it's possible that some people may be able to function just as well on slightly less sleep, like 6 hours, and some may be able to function just as well on slightly more sleep, such as 10 hours. So it really does depend on the person. However, I will say that those are the exceptions. The majority of us do need 7 to 8 hours. So that's what we're aiming for. Okay, so we've talked about how great it is to get good sleep and how horrible it is to get bad sleep. So let's talk a little bit about what we can actually do to make sure we get better sleep. So there are some things you can do, and you may hear the term having good sleep hygiene or good sleep hygiene. So this just means, getting better sleep. So some things that we can do are, regardless of what your schedule is like in terms of what you have to do every day, if you can stick to a consistent sleep and wake schedule every day, that will help your body to just kind of establish that norm of getting to sleep at the right time. So regardless of what you have to do, if it's a day off or you have to go to work, for example, you want to wake up at the same time every day. Of course, that's not possible with every situation, but as best as you can, and just trying to find what the best rhythm is for your lifestyle, for your life. You can also practice a relaxing bedtime ritual, kind of like a wind down, and this can help you to shift into sleep mode. So this can be something like in the last hour before bed, you do some sort of calming activity, ideally no electronics with screens, so no TV, no computer, no cell phone, just trying to get the lights nice and dim. Maybe you do relaxing activities such as breathing exercises, a meditation, maybe some stretching, maybe you, crossword puzzles, reading, something like that. That's kind of a quiet, calming, relaxing activity. Some other suggestions. So I find that people generally fall into one of two categories. Either you have trouble falling asleep, or you have trouble falling back to sleep if you wake up throughout the night, or you're waking up several times throughout the night and then not able to fall back asleep. Some people have issues with both. So for people who have a hard time falling asleep in the first place, and what I usually hear is that these people tend to have a lot of thoughts going on, You're thinking about things you have to do, thinking about things that happen throughout the day, things you should have said, or things that other people said to you, and just you can't shut your mind down. So one thing is, if you can't fall asleep after 20 to 30 minutes, try getting up and going to another room to do, again, one of those relaxing activities until you feel tired. And again, don't turn on all the lights, keep it dim, keep it relaxing. Find an activity that you enjoy. Maybe it's reading, maybe you do a meditation, maybe you do some deep breathing, whatever it is that is calming and relaxing for you. Okay. You want to also speak with your doctor if you notice that you are having ongoing sleep issues, your doctor or a sleep professional. And you may want to consider keeping a sleep diary to help you to prepare for this appointment, so it gives your doctor some more information about what the main issues might be, or what the root cause of the issues might be. You want to avoid napping if you have trouble sleeping, especially in the afternoon. And if you are going to nap, you want to nap earlier in the day and not for too long if it's affecting your sleep. Napping, unfortunately, does not make up for getting bad sleep at night. It can help you get through the day, but it doesn't exactly make up for bad sleep. So if you have trouble sleeping, try to avoid napping.